you ponder the problem of achieving universal health care coverage in this country, the more you realize that Congressman Anthony Weiner, Dennis Kucinich, and about 100 of their colleagues are right. The more you realize that the late Senators Daniel Patrick Moynihan and Ted Kennedy were right. The best, cheapest, indeed the only way to get to universal coverage is by extending Medicare to everyone. But because Democrats gave the biggest healthcare profiteers a place at the bargaining table, they are fighting to protect their profits. Can't really blame them. Their executives' allegiance is to shareholders, not patients. Well, their strongest allegiance is to their absurdly oversized and utterly undeserved pay packages. And so it has always been and always will be. David Brennan, CEO of pharmaceutical giant AstraZeneca, gave notice today to Huffington Post that Big Pharma's tenuous support for healthcare reform will revert to forceful opposition if anything like the House healthcare bill emerges as the final package. You may recall Big Pharma struck a deal with the White House and the Senate Finance Committee that healthcare reform would not empower the government to pay the cheapest possible price for drugs. The House bill does not observe that deal. And then there is United Health, whose lethal pursuit of profit has been chronicled before on this program. With reform options narrowing as we near release of the Senate bill, the group Consumer Watchdog reports that United has once again emailed its 75,000 employees asking them, voluntarily of course, to lobby the Senate against including a public option. The motive for all of this, already obvious, but laid bare in a new study from Goldman Sachs, which concludes that the House bill would actually reduce insurance company earnings. Under the Senate Finance Committee bill, earnings would rise by a healthy 5%, which Goldman Sachs, of course, considers disastrously meager. The best scenario for insurance company profits? No prize for guessing this time. Status quo. Killing healthcare reform is the best profit plan for the insurance companies once again. Republicans, in a new ad, are targeting conservative Democrat Mary Landrieu of Louisiana for indicating she might allow healthcare to come up for an up or down vote on the Senate floor.
Remember this?
I actually did vote for the $87 billion before I voted against it.
The flip-flop. Democrat leaders want Senator Mary Landrieu to use the same tactic to pass President Obama's government-run healthcare experiment, with a vote to move a bill forward with tax increases, cuts to Medicare, and rising premiums. Then, once it comes up for a final vote, they will allow her to vote against it.
Of course, Republicans also put out ads arguing for exactly this kind of flip-flop when they wanted Democrats to allow up or down votes on things Republicans wanted, namely judges.
Senate Democrats have abused the rules and refused to even allow a vote. So courtrooms sit empty while thousands of Americans have their cases delayed. The job of a U.S. Senator is to vote. Urge your senators to vote up or down. Enough is enough.
With us tonight from New Orleans in Senator Landrieu's state of Louisiana and site of tomorrow's free health care fair, the first sponsored by donations from Countdown viewers, are Nicole Lamoureux, Executive Director of the National Association of Free Clinics, which runs these fairs, and one of the volunteers who will be working the fair tomorrow, Dr. Corey Hebert. I should note that tomorrow's clinic will be held from 8 to 5 at the New Orleans Convention Center. People can register for an appointment or donate at freeclinics.us and at countdown.msnbc.com. Since Keith first called for these clinics, you have donated $1.7 million. Tomorrow, at least 1,300 registered patients will benefit from your generosity, along with that of 616 volunteers, including Dr. Hebert. Thank you both for your time tonight, as well as your time tomorrow. Before we get to the policy, Nicole, how do things look for tomorrow?
They look wonderful. We're very, very excited. As you said, 1,300 patients already signed up, over 600 volunteers. We're ready to go. We're ready to open the doors right at 8 a.m.
Dr. Hebert, on a personal level, why are you volunteering? How did you find the time to volunteer? And as a matter of public policy, why do you think it's necessary to run these kinds of clinics?
Well, it's so important for this city, number one. This facility was the place where so many people died 4 years ago. Now, 4 years later, we're giving life to this city. This is so important. I met Nicole at the Dr. Oz Free Health Clinic in Houston. We talked about it. She said, you know what, it's a go. I said, you know what, I'm going to be your man. Let's make it happen. I'm the medical director of this thing, and it's going to be a great, great day. We need more things like this because the people that come to these types of events are the working poor. 80% of the people that come to the free health clinics, they have a job. It's not just for poor people.
Nicole, one of the reasons Keith wanted to do this in New Orleans was precisely so that Senator Landrieu would see how real this need is in her home state. Now she has Republicans telling her to block a vote on health care reform. What message do you and do you think tomorrow has for Senator Landrieu?
Well, I think what message we have, not just for the senator, but every member of Congress, is that while you're discussing health care and you're having this debate, there are people every single day providing quality health care to those people who need it. So there are opportunities right now for people to get involved in. I think that's the first most important message while everyone else is talking about the debate.
Dr. Hebert, as a practitioner, you know that we will still need these clinics, even if health care reform passes, because none of the bills come close to providing universal coverage. How do you explain to the 15 or 20 million people who will still be stuck without health insurance why their government chose to leave them behind?
This is a very, very serious question that people have to get to the crux of. Nobody really wants to do poorly. People want to do well. If you give them cloudy water, they will drink it if they have no option. They want clear water. So my message to everyone out there is keep on keeping on, folks. And with the National Association of Free Clinics, there will be more facilities out there. Seek them out. Find them, because in the final analysis, people are here to help you. This event will see 1,400 people tomorrow, maybe even more. We're not turning anybody away, but there are free clinics in New Orleans that have existed since Hurricane Katrina that will continue to see the patients that need to be seen, and they're all over the United States.
Dr. Hebert and Nicole Lamoureux, thank you very much for your time tonight, and more importantly, your time tomorrow.
Thank you.
If you'd like information on future health fairs, you can go to freeclinics.us or countdown.msnbc.com.